the things Canadians fear the most, having a stroke. Even more than having a heart attack, people are terrified of having a stroke. In this next story, you'll see, based on one man's experience, that we're not helpless against stroke, but what you don't know could kill you. By the time Howard Rocket was strapped down in the ambulance, his brain was already starting to die.
Howard? Can you hear me, Howard?
Hours earlier, a small blood clot had broken loose and went racing like a bullet through his bloodstream. What happened next is called a stroke.
It was all basically in slow motion then. As I was getting sicker, it seemed like everything was just slowing right down. The sensation in the ambulance was looking down, an out-of-body experience basically, but looking down on myself and I'm thinking that, boy, that guy looks terrible, but he looks just like me.
The tiny clot finally slammed shut an artery in his head, blocking off oxygen to part of his brain.
What time did you
Howard Rocket had just suffered one of the worst strokes possible. Most victims die.
In retrospect, I was experiencing all the signs that somebody would who's having a stroke or about to have one.
I'm gonna take some blood tests, okay?
I was experiencing some very bad headaches, and I've had migraines before, so I just sort of put that to migraines. And I didn't know enough to recognize the signs and symptoms of a stroke.
Howard, it's Dr. Silver. I'm a neurologist. I run the stroke team.
Like an efficient and well-oiled machine,
Can you speak at all?
the stroke team goes into action. Every second counts.
Time is brain, and it's a great phrase because it emphasizes that every minute that passes means that more of the brain that's at risk, brain that does not have its blood supply, it's dying. Can you wiggle your fingers a little bit? Okay. Do you know this is your arm? We have a very short window to work with. Look at your legs here. If you can get a patient to a hospital and apply newer therapies within the first 6 hours, we have a possibility of improving the outcome. In the best case scenario, if the patient gets to us very early and we can dissolve a clot, restore the blood flow, the patient can walk out the next day completely back to normal.
Howard often refers to his stroke as a stroke of luck. His good fortune was that he was brought here.
Okay, just do not move, lie still. It's only going to take about 10 minutes for the scan.
Dr. Frank Silver's stroke team is simply one of the best, and years of heart and stroke research helped them get that way. State-of-the-art equipment and expert advice from radiologists supports the team's ability to find the source of the stroke and send a catheter directly to the obstruction and obliterate it with a revolutionary new clot-busting drug.
You can see that the basilar artery is opened.
Startling before and after x-rays. On the right, nothing, a blocked artery. But once the killer clot is removed, a life-giving stream of blood blossoms to the brain. Science has just given Howard Rocket the chance to walk again.
There is a lot of work to be done. There's a lot of advances that are yet to be discovered. What we hope is a situation where patients recognize the symptoms and signs, and we have the tools and the drugs to really reverse the process so that no one has to suffer with a lifetime disability from a stroke.
The fact that Howard is alive at all is a miracle, but the damage to his brain and body was minimized because of the stroke team. After his stroke, he was paralyzed, but he survived with the love and support of his family. At first, he couldn't speak a single word, which led to the forming of a special bond with his youngest daughter, Dana, who seemed to know his every thought. Father and daughter used a secret sign to signal the hope they shared.
He always taught me to fight 100% for whatever I wanted. So every time when I left his bedside for a couple minutes or whenever I left, I would just say, Dad, fight 110%. And his way of telling me that it registered was he went like that every single time. So I knew he was listening.
I think that if there was a guardian angel, she was it. You can't survive what I did without tremendous help. And that help came from everywhere.
The events of that tragic day did not destroy this family, but rather affirmed it. as a family that's of every single day.
The whole experience has really been a stroke of luck. The stroke actually showed me the pathway to go in life and what is really, truly important.
With their secret sign, Dana greets her father on this a milestone day for both of them. Howard's goal today was to raise his paralyzed arm and dance with the daughter he loves so much.
My goal is to raise my arm up just a bit. Not all the way, but just a bit. And she won't have to grab it to bring it up. That's my goal. It's not a dream because I'm going to do it.
And he will be dancing with his arm lifted at Dana's wedding. I know that for sure.
A fairy tale ending and a moment frozen in time. A moment that almost didn't happen at all.